Good morning, everyone, and thank you for joining me today. It was just over a year ago that our government announced we would be refocusing Alberta's healthcare system, that we would establish 4 individual yet unified health agencies or pillars dedicated to delivering primary care, acute care, continuing care, and mental health and addiction services. We promised every Albertan, regardless of where they live in our province, access to the care they need, when and where they need it. I am proud of what we have accomplished in a relatively short period of time. I am also incredibly grateful to all who have contributed to this success. From the earliest days of this initiative, we've relied on Albertans and healthcare workers across the province to help guide us, and we made this deliberate decision to be flexible with timelines to ensure we get this incredibly complex and incredibly important work done right. I'm pleased to provide an update on this work today and say that the new system is taking shape. So this past July, the Ministry of Mental Health and Addiction stood up Recovery Alberta, and today Primary Care Alberta becomes a legal entity and officially begins its work under the leadership of CEO Dr. Kim Simmons, who is here today. Soon, these 2 provincial health agencies will be joined by the agency responsible for acute care, which will be known as Acute Care Alberta. Acute care is a significant part of the healthcare system, with complexities that require us to be thoughtful and intentional, so Albertans see tangible improvements to the healthcare delivery. Albertans deserve quicker access to care, reduced wait times for important surgeries that will benefit their health and quality of life, and to know that if and when they need emergency health services, it is there for them, no matter where they live. We want to get this work done right. The acute care system is complex, and making sure we set the system up for success now and into the future is critical. That's why we are shifting the timelines for when Acute Care Alberta will be operational. Early next year, Acute Care Alberta will become a legal entity and begin operations in early spring. While this is an adjustment to our initial timelines, providing Albertans with a healthcare system that is sustainable and effective remains our top priority. Establishing the Acute Care Provincial Health Agency will follow the phased approach that was used for Recovery Alberta and Primary Care Alberta. Alberta Health Services will continue to play a key role in delivering acute care services with a renewed focus on shorter wait times and higher quality care for patients. AHS and other healthcare providers, such as Covenant Health, will be accountable to the Acute Care Provincial Health Agency. And to support the stand-up and implementation of the Acute Care Provincial Health Agency and to ensure that essential services and the patient experience are not interrupted during the process, my department has the continued leadership and dedication of AHS is critical to ensuring a successful stand-up of the acute care organization next year and to the continued success of AHS as a valued healthcare provider. I mentioned earlier that as of today, Primary Care Alberta will be a legal entity, is a legal entity as of today. The immediate work will be to implement corporate policies and processes, develop operational plans, set Primary Care Alberta's vision and mission and performance targets, and work with stakeholders to meet the goal of ensuring every Albertan has access to high-quality primary care services so that they and their families are supported in their day-to-day health needs through every stage of life. As our new healthcare system takes shape, it's important that Albertans understand and connect with the agencies that will be leading the charge of change. That's why today we are also pleased to be unveiling the new logos for both Primary Care Alberta and Acute Care Alberta, which you can see behind me. Each provincial health agency will have new and distinct yet complementary brands. Cohesive colors among the provincial health agency logos reflect our commitment to fostering integration within a unified and refocused healthcare system. While the distinctions between each brand highlight the unique qualities of each agency and reaffirm our promise for a new direction for healthcare. A brand is more than its logo. It reflects each provincial health agency's intent and promise of what it will achieve for Albertans. Primary Care Alberta is the first step to a healthier future. By delivering accessible services and coordinating resources, it will help prevent illness, promote well-being, and enhance quality of life for all Albertans. Primary Care Alberta's branding uses connectivity to communicate a team-based care model. It reinforces care and compassion and puts the patient at the center of the care. And it represents the diversity of healthcare professionals under the Primary Care Alberta umbrella. Pardon me. By improving access, empowering healthcare professionals, and being transparent, every Albertan will get the high-quality, timely treatment they need during emergencies and for serious illnesses. And through unique branding for Acute Care Alberta, we hope to increase awareness so we can all better understand when to use acute care services instead of primary care services. We will keep Albertans up to date as the work to stand up the Acute Care Provincial Health Agency continues. In the meantime, there will be no disruption to service. Albertans will continue to access acute care services as they always have. And healthcare workers will continue to provide that same exceptional care. In addition to these updates, we're also taking a more integrated approach to the health system planning to inform provincial and local decision-making and better respond to the needs of Albertans. We are going to do this by transitioning from 5 standalone regional health zones to 7 integrated health corridors, whereby we will make better informed decisions about services, workforce, and infrastructure. Because the new corridors reflect where Albertans are accessing care, we will be better able to determine existing gaps in the healthcare system and where investments, including operational dollars and funding for capital projects, should be allocated. Lastly, I want to emphasize that engaging with healthcare professionals, patients, and all Albertans has been and remains vital to our work to refocus the healthcare system. I encourage all Albertans to participate in upcoming telephone town halls where we will be discussing the ongoing work. Our next telephone town hall is tomorrow morning, and 2 more are scheduled for November 27th and 28th. You can register at alberta.ca/leadtheway. Again, alberta.ca/leadtheway. I also encourage you to provide feedback through an online form until December 5th and to sign up for an e-newsletter that will keep you up to date on the healthcare system refocusing work. A second round of in-person public engagement is planned for early 2025 to share information and to receive feedback on our ongoing refocusing work. Over the past year, I've witnessed the passion, the dedication, and tireless work of our healthcare workers and allied healthcare professionals right across our great province of Alberta. A record-breaking 304,500 surgeries were performed last year. That's the most Alberta has ever done in a single year, with expansions to operating rooms in 19 different communities to boost surgical capacity. This year, we are on track to surpass that amount to nearly 310,000 surgeries. I also want to share that as of November 1st of 2024, AHS has already completed approximately 9% more cancer surgeries compared to the same time last year. For the second consecutive year, a record number of registrants renewed their permits with the College of Registered Nurses of Alberta to continue practicing in Alberta. So over 44,798 registrants are now practicing, and there was an 11% increase in renewals for RNs and 15% increase for nurse practitioners. Finally, at the end of September, there were 12,126 physicians registered in Alberta, an increase of 518 physicians compared to the same time last year. We have also seen a 5% increase in the number of family physicians over the same period. So these record numbers reflect that there are more doctors registered in Alberta today than at any other time in the province's history. I am very encouraged by what I'm seeing, and that is why we have committed to continuing our refocusing work and reaching the finish line so we have a healthcare system that truly works for all Albertans and for all healthcare workers as well. Not just for now, but for many generations to come. And so thank you all for attending, and I look forward to your questions.
We have Dr. Simmons, Dr. Eagle, and Minister LaGrange available. If you could please just state your name and outlet, and we'll be taking one question, one follow-up today. We'll start in the room. Lisa, go ahead.
Hi, Lisa Johnson with the Canadian Press. Minister, you said that you're proud of what you've accomplished over the past year. I'm wondering if you can talk a little bit more about some of the indicators of access, but just one thing that you mentioned there, we're going from 5 zones to 7 corridors. Presumably each one of those corridors is going to have a CEO. So I guess just generally, what is the basic ratio of administrative positions versus frontline workers, and how has it changed in the past year over the course of this refocusing?
Well, you've got a number of mixed questions in there. I'll start with...
You're more CEOs, basically.
No, just because we have different zones doesn't mean we have to have different CEOs for those zones. And currently, Alberta Health Services had quite a large number of management positions. That has been reduced by at least 500 at this point in time. And obviously, there's more work to be done as we streamline, and AHS continues to streamline its own service delivery. Under the health agencies, we are, of course, having a CEO for each of the health agencies. But again, it is really a, when you look at how AHS is streamlining and making sure that the positions that were within Alberta Health Services that fall under primary care, Recovery Alberta, and also continuing care Alberta, that those positions also make, that we equalize the positions out into those other areas. When we look at the zones, the reasons the zones are now going to health corridors is really to make sense of where people travel and utilizing the travel patterns as well as the facilities that are in those health corridors. When I first became the minister, it just never, and even before that, just never really made sense to me. Like, I'm in Central Zone, being in the Red Deer area, that we would have Vegreville in Central Zone. So if there was something that needed to be handled, they would send ambulances down to Red Deer rather than going across to where the normal travel patterns are. So there's a lot of looking at, what do we have in each of those health corridor areas that need to be kind of a core basket of services, and what are the facilities like? How do we improve those facilities, and how do we make use of the natural travel patterns? So we have a lot of data that we were able to use to make evidence-based decisions on those health corridors. Pardon me.
Okay, and just to clarify, management positions have been reduced by 500. Is that people moving from AHS to different organizations, or are those people who have been
that
fired?
are vacant positions, as well as other positions that are no longer existing within Alberta Health Services?
Okay, and just a specific follow-up in terms of indicators.
And that's an approximate number.
Okay. Has the number of patients getting their first oncology consult within the recommended window improved or worsened since the start of the refocus?
Well, we've got actually the number of people that are being diagnosed with cancer has actually increased, as well as the number of follow-ups that have to take place. We are seeing, because we have an aging population, as well as the fact that we just have a growing population within our province, that we are seeing a higher incidence of cancer diagnoses, which also puts a strain on the overall system. But we are looking to make sure that we have are recruiting into those oncology positions, because we did have a bit of a gap on the number of oncologists, and we're making strides to recruit into those positions. I'm understanding that we're making good strides in that area.
So it has improved? I didn't hear a yes or no.
In certain cancers, it has improved. In others, it has stayed the same. or, you know, it needs to be addressed. So
Thanks, Lisa. Jonathan, go ahead.
it is a key priority for us to address.
Hi, Jonathan Bradley, Western Standard. So Acute Care Alberta will begin operating in spring 2025. Why is the Alberta government waiting until spring 2025 to begin operations?
Well, there's a lot of work that has to be done. As we always said, Acute Care Alberta will be the agency overseeing acute care, which will have Alberta Health Services as a service provider, as well as Covenant Health and the chartered surgical facilities, just to name a few of the areas. We want to make sure we get it right. And so we said all along, we're going to take our time and make sure that we do things in a proper manner. So it will have a legal first date in early spring of 2025 and be functional by my hope is the 1st of April.
Okay. The Alberta government said it has established a transition team with ACA. Why did you feel compelled to create a transition team?
Well, again, it's very complex, and so there's a lot of interweaving of services, and we want to make sure that those services, as they're being allocated out to primary care Alberta, continuing care Alberta, that we get that work done properly.
Thanks, Jonathan. Shay, go ahead.
Thank you, Sean Skolsky with CTV. Earlier this year, the Premier had said that she would be looking at handing over the service provision of hospitals from AHS to Covenant Health. Is that still the plan? And what will be the indicators to determine if that does take place? And what do you say to concerns from those who have worries about certain procedures such as abortions or MAID that won't happen at Covenant Health facilities?
Well, and I believe what the Premier said was that if a service provider is not doing the work that they're doing, and in that particular case it was Alberta Health Services, but it could apply to Covenant Health or to any other service provider in the future, that if they're not doing what they're doing, we as Albertans demand good quality care, and so we would look at alternative options. And right now we only have two options. We have Alberta Health Services and we have Covenant Health that provide acute care services. And so we know that in LaGrange, there was already a decision made by the community that, along with Alberta Health Services, that in the best interest of the community, as they're looking to build a new facility out there, that they would like to transition to Covenant Health. This would not be a decision that's made unilaterally by the government. It will certainly be in conjunction with the community as to the wishes of the community.
Just a follow-up to that and then an additional question. I guess what markers will you be looking at if AHS isn't doing the job that they're supposed to be doing? I guess what are the benchmarks to determine that? And then also in regards to the services that some fear that Covenant Health won't provide, again, abortion, MAID, would they be mandated to do so? Would you be looking at another service provider? And then those were my follow-ups. Why more consultation? I mean, you've talked about this before. You've said you've heard loud and clear this is what Albertans want. So why launch more town halls? Why do more engagement if you're confident this is the
I'll start with your
plan?
last question. So more consultation, because that's what we heard. That's what we heard from Albertans. When we did the consultations across the province, we had 65 in person. We had over 30 in-person Indigenous consultations as well. We had 18,000 people that responded to a survey. We had over 10,000 people in telephone town halls. And we heard resoundingly they want to be connected. They want to have that ongoing voice. Oftentimes when we do engagement, it's one and done and we don't hear from them again. And that's not what I want to do, and that's not what they want. They want us to continue that engagement. The refocusing isn't just, it's done and over with. It's an ongoing process, and part of that process is really listening and incorporating what we're hearing from the front lines and from people. The vast majority of people that have taken place, that have taken part in the engagements, have been frontline workers, and the information we've gotten from them has been invaluable. Like, we've been able to incorporate as much as possible, and there's more work to be done. Obviously, we can't do it all at once. On the facilities, now I just want to go back to abortion is not done in any of our hospitals unless it's an emergency procedure. And that is done both in public and in Covenant Health hospitals, AHS, as well as Covenant Health hospitals if it's an emergency. They're done in actual clinics. And so nothing changes there. And as far as MAID, there's an central intake, and there is the ability for doctors as well as facilities to have conscience rights in that, and that currently exists right now, so there's no change to that either.
Thanks, Shailene. We'll keep going. Go ahead.
Lisa with Global. What would you say to, all the medical professionals that we've heard from, throughout the fall, asking you guys, when is this coming out? The expected rollout was in the fall of this year. And yet it sounds like all that's new today is, logos, incorporation of the official legal company of these two, and then you have a team kind of rolling things out. Is there anything else that is kind of tangible right now or that's in the healthcare system that's part of this new system?
Well, I think all the tangibles you can already see, like we already have Recovery Alberta up and functioning and working as a separate entity, yet still very much integrated into the rest of the system. We've got, and I'm seeing great strides in that area already in terms of the services and the focus that they have on mental health and addictions. I'm hearing from stakeholders already, from health partners, that they're already starting to see on the ground the difference that that's making. Even the fact that there's a dedicated envelope of funding that went from 50 million for mental health and addictions when it was stood up as a ministry to 700 million, roughly about 700 million under Alberta Health Services. And now that's at $1.4 billion for mental health and addiction across this province, and more to come in terms of targeted ways of dealing with mental health and addictions in Alberta. We have got, as I said, day one with primary care, and I'm happy to let Dr. Simmons have the microphone and just already share all of the prep work that's going on behind the scenes to get that new agency up and running. Acute care, again, we don't want to make any missteps, and so we want to make sure that we are, in fact, getting the right people in leadership and making sure that everything is sorted out as we move forward. So we said all along that we would be thoughtful on the processes. We are in fall. We've got 2 agencies already set up, the next one coming very quickly, and we've already made a statement in terms of continuing care that we're looking to make sure that as we move forward with continuing care, that it will be under the leadership of Seniors, Community and Social Services as a sector minister, because it really is a continuum of care from needing maybe just a little bit of care as a senior or someone with disabilities to the other extreme of intensive care, 24 hours a day, 365 days a year type care. So we're making that very thoughtfully. It needs to be thoughtfully done because people's lives hang in the balance.
And what's the latest on pay structure in terms, I know that a big issue was obviously for doctors just how the pay scale works, or when they have a patient, how many patients they can have. Any changes to that, or what's the latest?
So on the primary care, physician compensants, et cetera, that need to be done, and I'm hoping to have an announcement fairly soon on that.
So we should have it before next year, a change in that structure?
Yes, because we've already committed to having it implemented for April of 2025, but there are some things that we still have to work out with the Alberta Medical Association.
Thanks, Minister. We're just going to quickly move to the phones, and then we'll come back to the room. Operator, can you put through our first caller, please?
Your first question comes from the line of Pedro West from Global National. Please go ahead.
Thanks for taking my call. This is for the Minister. It's a bit off topic, if that's right. We learned last week of the serious human case of H5N1 in BC. I just wanted to...
Excuse me, sorry. You're really garbled. We can't hear you very well. Could you repeat that?
Sorry, is this better?
Sounds better.
Okay, thank you. This is a bit off topic, but I wanted to ask about H5N1. Of course, last week we saw the serious human case in BC. Minister, if you could comment on how Alberta has stepped up monitoring, and have we seen any probable, likely, confirmed human cases in this province as of late?
So yes, under the our public health, we continue to monitor this. We will be, obviously we're in contact with other provinces across Canada. There was a suspected case that has actually been confirmed not to be a case. So that is all I can say at this point in time, but we will monitor it and continue to monitor it closely.
Thank you.
Operator, can you put through our next caller, please?
Your next question comes from the line of Don Braid from Post Media. Please go ahead.
Well, Minister, could you tell me about the discrepancy, incredible discrepancy between what you say about number of doctors on scene and number of doctors leaving or not leaving, same with nurses, and the AME's version of this, which is always that many doctors are leaving or thinking of leaving. And of course, they keep pressing for the panel pay agreement, which now appears won't happen until the next budget. Who's telling us what's really going on here? Is it you or those guys? Because the difference is stark.
Well, my numbers are from the College of Physicians and Surgeons. The Alberta Medical Association obviously is there to advocate for their physicians, and I know in a lot of their communications they're saying their family physicians are thinking of leaving by 2029. Obviously, we're only 2024, so I'm not sure why 2029 is the number they continue to put out there. But that being said, I've heard from many physicians that I speak to in my day-to-day journeys and family physicians, and they know that we're working really hard to make sure that we get a primary care compensation funding model for family physicians and rural generalists that actually will be sustainable for the long term and that it'll be successful. And so that is our goal, and we're going to continue to work on that goal. But my numbers actually do come from the College of Physicians and Surgeons, and you know, you can compare it to other years, and I would say this is the largest number of physicians that we've seen in the province. I also want to give kudos to the College of Physicians and Surgeons because they have streamlined their processes as well. Up until March of this year, only Alberta Health Services could sponsor an international medical graduate physician. And now that is open to clinics as well as municipalities, et cetera, communities that would like to sponsor a physician. As of, I believe, last week or the week before, they've also opened that for specialists. So now that will also be available. Not only will Alberta Health Services be able to sponsor a specialist, an internationally medically trained specialist, but also facilities, communities, et cetera. So given our great tax regime and, you know, just being a wonderful province to live in, we have a lot of benefits here, and we're hearing from physicians that and other healthcare professionals that we are an attractive place to work.
Could I follow up, Minister? Even now, people who need hip or knee replacements are getting messages saying that they will be able to see a specialist in 23 to 28 months. These notices are still going out. People are still getting them. People are leaving this province, going to all sorts of weird places to get their surgeries done, including Montana, Toronto, Montreal, Vancouver, oftentimes by Alberta surgeons who go there to do the operations. This is weird and it seems desperately dysfunctional. Could you tell me how and when you will finally be able to address these long waiting lists to get into care? I know your figures show a different story, but so many people wait so long to even see a surgeon. I
agree, and it's unacceptable, and that's why we're working really hard, taking a multi-pronged approach, getting more specialists and building more capacity within the province. It's why we have the Alberta Surgical Initiative, where we can expand the number of surgeries that are being done across the province, as well as our chartered surgical facilities. As I said, we're on track to have the most ever, 310,000 surgeries, but it's unacceptable that people are waiting long times. And so part of it also for people that are leaving the province, it's because of the Canada Health Act and the way it's currently structured, that they're not able to, if they wanted to, pay for those services within the province, there's no mechanism for them to do that. So, they do have to go out of the province. It's a product of the Canada Health Act, the way it's currently written. So our focus is improving capacity, making sure that we have the right specialists, the right number of specialists, right number of surgeons, the right number of family practitioners, and other allied health professionals, that there's a streamlined process, including the FAST process that people can access and get onto so that they can get their surgeries done within a clinically approved time frame. But we know there's more work that has to be done here, and we're committed to doing that work. I'm hoping to have even more signs of positive movement forward in the next little while. Just have to take a multi-pronged approach.
Thanks, Dawn. We have time for one more in the room. Go ahead.
Thank you, Matthew with the Journal here. I want to ask about the cost associated with this and any delays with the acute care organization. Like, are we still within our budget for this transition, or how does this affect that?
Yeah, we had an overall budget of $85 million over 2 years, and we anticipated $17 million. We did not reach the $17 million in the first year, and so we're looking to be on track, actually probably under budget.
Okay. What does all this mean for healthcare workers, what you're announcing here today?
It means for the vast majority of them, they're going to continue to work for Alberta Health Services. If they're working for Alberta Health Services, we just want to make sure that they know that we are moving forward with the refocusing, that we will continue to listen to them, listen to their ideas, and make improvements on the front lines. There's a lot more work that has to be done, and we're committed to getting that work done.
Okay, we'll leave it there today. Please send me an email with any follow-ups. Thank you.
Thank you, everyone.